For the McDonald's, winter can be a wonderland, but it can also be a season of terrifying anxiety. Steve and Leslie's oldest daughter, Lauren, suffers from a severe case of febrile or fever-related seizures. The slightest cold or flu can cause her temperature to spike dramatically, resulting in a frightening, convulsive seizure.
She would go from no fever at all to 104 to 105, which for Lauren's body, she just couldn't handle her body temperature rising that quickly. It's extremely scary. You've got this beautiful child who, up until this point, has been developing completely normally according to all the doctors' well visits, and all of a sudden you see your child just drop to the floor and go into that seizure mode with the eyes rolling back in the head and turning that pale color with the lips turning blue and there's very thick foam coming out of their mouth.
Febrile seizures affect up to 5% of children, most often during the first 2 years of life. They usually last 2 to 4 minutes. Most children who suffer from febrile seizures have 1 or 2 before outgrowing them. Lauren has had no such luck. She's had 9.
The first seizure Lauren ever had, she was just almost a little bit over 14 months old. In the middle of the night, I heard this moaning and groaning coming through the baby monitors. So I went into her room and I looked in her crib and she was just laying in the crib, totally lethargic. So we picked her up, called 911, and they took her to Hasbro Children's Hospital. And what they told us at that point was that she had had a convulsion. The following evening, Lauren was walking through the family room and she just collapsed on the floor and started having the seizure. So there's never any warning signs with her.
No, there isn't.
Our movements begin in the brain. Here, neurons communicate using electrical and chemical impulses. During a seizure, a trigger such as fever causes an electrical storm, overloading brain impulses and causing neurons to go haywire. The resulting seizure causes an immediate flurry of nervous system activity, which can result in abnormal movements of the limbs, interrupted breathing, and even a loss of consciousness.
Most parents believe their child has died or is about to die, and in fact, that's very unusual.
Dr. William Brown at the Hasbro Children's Hospital in Providence, Rhode Island, is Lauren's pediatric neurologist. He quickly calmed the McDonald's worst fears.
The usual reason that a child does die during a seizure is because they drown in the bathtub or they fall out of a tree. The seizure doesn't cause brain damage. It's not painful to the child. They won't remember it in the morning. So what I usually tell people is that it looks a lot worse than it is.
If a febrile seizure lasts more than 3 to 4 minutes, doctors recommend calling an ambulance.
The most important thing to do if a child has a seizure in front of you is not to panic. Most febrile seizures are over within 30 to 40 seconds, but 30 to 40 seconds may seem like hours to a parent who's never seen one before.
The best way to prevent febrile seizures is to minimize the risk of fever. Acetaminophen and ibuprofen usually work well. Sponging the child down in a tepid bath also can help reduce the high body temperature. Due to the alarming frequency of Lauren's seizures, Dr. Brown prescribed an anti-seizure medication called phenobarbital. Luckily, the McDonald's worries may soon be over. Lauren has been seizure-free for over a year. 2 more months without a seizure, and she can stop taking the medication.
For Lauren, we're really seeing the light at the end of the tunnel for her, that this is something we as a family and Lauren can put behind us. And I think once we see Dr. Brown in March and he gives us that good news about taking her off the medication, that would probably be the best news that we could hear for Lauren.